Thank you everyone for joining us today. We know you're all super busy, so we're honored that you chose to spend the next 60 minutes with us, with Klara, with KM² Solutions, and with Schweiger Dermatology Group to discuss ways to improve practice communication. Before we get started, I'll let today's distinguished panel introduce themselves and their companies, and then I'll give you a quick introduction of myself as today's moderator and some housekeeping notes, and then we'll kick things off. Paige, Janelle, Laura, welcome. Thanks for joining. Paige, why don't you go first?
Sounds good. Thanks, Simon. Hi, everybody. Thanks for joining today. My name's Paige, and I am on the customer success team here at Klara. My main focus is on implementation, account management, and the support of our Klara customers. We're super excited, and I'm excited to be on this panel. I'm the CSM for Schweiger Dermatology Group, and we have experienced some great accomplishments during our partnership so far. And just to give a quick background on Klara for those who are new, we are a HIPAA-compliant text messaging platform that makes it easy for healthcare providers to communicate with both their patients and their internal teams. Our goal is to save practice hours per day by documenting all communications in one single place and also giving your patients a convenient and great experience.
Great, thanks Paige for being here. Next up, Janelle. I think Janelle is frozen right now. Hello.
Sorry, I think I was having a bit of an issue. My apologies there.
You're back on. Hi, you're back on.
All good. Hi, everyone. My name is Janelle Neal. To speak a little bit about myself, I've been working in the BPO outsourcing side for around 10 years now. Most of my experience has been the last 7 years partnering with different specialty medical groups that have decided to outsource their business with us at KM² Solutions. As a company, we do have a very strong vertical on the healthcare side. We do manage several different types of specialty accounts on the medical aspect of it. I'm really excited to be invited today and for the conversations we're going to have. And again, thank you for the invitation and thank you all for joining.
Great, awesome. Happy to have you here. Laura, please go ahead.
Sure. Good afternoon, everybody. And thank you, Simon and the Klara team for inviting Schweiger Dermatology Group to the webinar. Excited to share our experiences today. I am the Chief Marketing Officer of Schweiger Dermatology Group. My name is Laura Fink, and I've been with the company for just under 2 years. My experience is in marketing. I spent over 15 years working at American Express, and after that was with Johnson & Johnson for a few years. So bigger companies and very exciting to bring those experiences in building the customer experience to Schweiger Dermatology Group. My role at Schweiger, I oversee all aspects of marketing and patient experience. A little bit of background on Schweiger Dermatology Group. We have 75 offices in New York, New Jersey, and Pennsylvania. We'll see 750,000 patients this year or more. And the company was started by Dr. Schweiger in 2012, and we have grown over the last nearly decade, in a lot of different ways. And I can certainly go into more detail on Schweiger, but have grown through, building new offices as well as a lot through acquisitions. So I'm excited to be here and share how we're partnering with Klara and KM² to build our business.
Thanks, Laura. Super impressive. And thanks for being our customer. Also, thanks for being on the panel. Hi, my name is Simon Baltz. I'm co-founder and co-CEO of Klara, and I'm going to be your moderator for today's webinar. All right. Before we jump in, I have a quick agenda to share so we all know what's going to be expected during the next hour or so, as we have a very busy session ahead with a lot of good topics. So during the first 45 minutes of the webinar, we will have a real-time discussion with the panelists about the communication and patient experience challenges that Schweiger Dermatology Group experienced after immense growth. And then take a look at the results they've experienced since implementing a patient communication strategy. So that's going to be super interesting. And for the last 15 minutes, we'll do a brief Q&A with the panel. So if you think of a question you'd like to ask during the webinar, please add it to the chat in your Zoom window below. There's a Q&A field, and you can just drop it in there, and I'll pick it up when we come to that section. All right. So one last housekeeping item before we begin. We will be sending an email out with the recording of the session to anyone who's registered. So you'll be able to watch this content again. And you can also share it with your colleagues and friends. We'll also be sending you a link with exclusive access for the webinar only to our latest educational white paper we just published. It's titled, "Does Your Medical Practice Need a Call Center?" So keep an eye on your inbox for even more great content. But without further ado, let's kick things off into the panel discussion. I'm going to stop all right. And we are starting with some questions. Are you all ready? All right, cool. I'd love to start with you, Laura. Maybe you can just start by telling us about Schweiger Dermatology's growth and how that came about.
Sure. So, I started to share a little bit there in the intro. Dr. Eric Schweiger is our CEO and founder. He started practicing in 2012 in one office and originally really grew through adding providers. And since 2014, started opening offices and then also buying practices. We now have over 75 offices in New York and New Jersey and Pennsylvania. We are the fastest growing dermatology practice in the Northeast, I believe the fourth largest in the US, with those 75 offices and about 250 providers. And that's sort of an overview of our company. We're headquartered in Long Island City, but certainly through the pandemic have been largely remote.
Great. Wow. So my first question, as Schweiger Dermatology grew and you started adding more and more of these locations going up to 75, did you find it difficult to scale a positive patient experience, and maybe give us examples why it was difficult or why it was not difficult?
Yeah, so I think the challenge that we all face in healthcare, particularly at our scale, is that patients expect a local experience. They want to call the doctor's office and speak to the people they're seeing at the front desk and feel like you know them. And that's, very easy to do when you have one office or two offices. But as we've grown and added more practices and brought in, different models and geographically spread out, we've increasingly centralized a lot of the servicing and really needed to manage making it feel very local and ensuring that those servicing the patients know the providers, know the offices, and know the patient. So that's really, I think, where a lot of the crux of the challenge comes in with growth, as well as maybe standardization, given that we're, often buying practices at different stages and, that may have their own experience that their patients have come to expect. How do you sort of bring things together when they started differently? So those are some of the challenges that, we faced, is really how do you maintain that local high touch experience while we grow it and centralize.
Mm-hmm. Super interesting. Maybe you can walk us through some steps you took initially to overcome challenges like that.
Sure. One of the things we did a few years ago was to, we wanted to get more insight. So we did partner with a company called Ask Nicely that is, allowed us to get really significant visibility into patient experience through NPS. That's a platform that we currently still use today, and it's very well integrated into our practice. And that gave us a lot of insight to work towards building out our patient experience. So that's one step that we took, and certainly a lot of internal communication and strategizing as to how to really build a scalable experience. And that's how we ended up looking at platforms like Klara and our patient management system and all of those platforms as far as how to build an integrated and centralized experience for our patients.
And what other, you mentioned a few, Ask Nicely Us, your PM system and EHR. What processes or also other technologies did you adopt to enhance specifically the patient experience?
Yeah, Klara was a big one. We had Klara prior to the pandemic, and then and we're NPS. I see the question. That's Net Promoter Score, which is really the barometer of patient satisfaction. It's that question: how likely are you to refer us to a friend? How satisfied were you with your experience? So that's NPS. Sorry for the acronym there. Klara. When we went into the pandemic, we were close to launching telemedicine, but that really got Klara much more integrated into our practice as we launched and rolled out telemed as our really only primary way of serving patients through that spring of 2020, and then really just have gone to build out Klara so much more as a key, really a cornerstone of our patient experience. We have Modernizing Medicine as our patient management system, and Klara integrates so well into that. So really the rollout of ModMed across our practice, as well as Klara, has been really integral. And then, of course, partnering with KM², which has given us just a lot more scale to service patients. Those three things are some of the steps that we've taken to build this kind of scalable model.
Great. And luckily all these things integrate smoothly with each other. So we'll come to KM² in a second. Maybe my last question to you and then move on is, when you select a vendor to overcome challenges like this, patient experience, what exactly are you looking for?
Yeah, this is a really important question, because I think everyone should be aware that while the technologies integrate, and that's something important to look at, you really need a team that you're going to be partnering with when you're looking for a vendor or a supplier for any of these technologies, because really nothing off the shelf just sort of works perfectly. There's a lot of education internally, and even if it does work perfectly, there's a lot of education. There are a lot of constituents of these platforms, not just the patients that are using Klara, but all of the providers that are using Klara in order to communicate with their patients. And even internally, how do we triage messaging to get them to the right place, which KM² plays a big role in doing for us. So, that is, I think when seeking a partner, you have your sort of technical requirements, but also really need to think about the softer side of, is this a team that I'm going to be able to work with well? Do I have the team in place to work with this team? Because it really is kind of an ongoing partnership and an ongoing build. So I think looking for technologies that are kind of easy to integrate and use, but also a team that you're going to really be able to commit to building with.
Great. Amazing. Thank you so much, Laura. Maybe moving over to Janelle from KM² Solutions. Maybe you can tell us a little bit of how your team works with Schweiger Dermatology Group and also other large practices to solve the communication issues and improve the patient experience. Janelle, you're muted.
My apologies there.
Now you're here. Okay, cool. You heard my question.
Yes, I did. Yes, I did. So just to go a little bit back on several of the items that Laura kind of mentioned, right? The opportunities that occur when you're scaling very quickly a medical practice are very similar across different medical groups, right? Here at KM² Solutions, we've had the opportunity to work with several different medical groups and see similar opportunities that come regarding the communication issues and how to improve the experience. I use an acronym that I call the PPC, and it's something that I have modified from the learnings from a prior leader that I had. And it's the fact that we need to balance the PPC. And what's the PPC? It's the patients, the people, and the company, right? Because as Laura said, right, as you're scaling, you still want to make those interactions to be meaningful. You still want to offer that stellar customer service that you are known to have, right? You want to make sure that your patients have an amazing experience from the moment they're calling in to schedule an appointment to the time they're at the receptionist, when they're seeing their provider, and with all their post-op or follow-up questions they may even have after a visit, right? So it's one of those key items, right? You want to ensure. And then from the people aspect, right? Once you're scaling, you're looking also for a vendor, you've got, or if you have your own contact center, right? At Schweiger, we call it the patient support center, right? That's the way we call a contact center. And you know, we want to make the processes less intricate, right? Less error propense for our representatives, right? And then on the office and the medical staff, right? And you know, I don't need to educate the people we have here, right? Providers have different types of preferences, from insurance, from age restrictions, from amount of patients they want to see in a given day, from different types of restriction, and we need to provide a tailored solution to them as well. And as a company, right, you know, as a business, we want to make sure that we're administrating our resource accordingly, and also we're hitting our financial targets, right? So as you see medical practices grow exponentially, there becomes the need to start managing interactions in a more efficient way. And with that is the incorporation of technology in space, right? I know I have been talking for a little bit, but I want to share a little bit of a sample of something we did that did involve all three of us, Klara, Schweiger, and KM² Solutions, regarding the improvement of a process. Mm-hmm. We have a back office group that kind of handles the scheduling and rescheduling of appointments through Klara. And we had an opportunity where we were seeing that our messages were starting to pile up, right? We were having backloads of messages. Some days we had messages from prior days that were not responded back. So the question comes, is this a staffing or is this a workflow, or is it both items, right? We went together and did a time study. We presented these results back to Schweiger Dermatology Group and made recommendations regarding how to efficiently change the workflow as to how we were working these messages. The process in itself was a bit inefficient, and it was creating one interaction could have ended up becoming 2 or 3 interactions, whether in a way that it could have been resolved into one. So we did several modifications and recommendations to this, right? With the changes we incorporated, today I can tell you we don't have a backlog of messages, right? Our folders are empty. We don't have patients waiting for responses for hours. We're getting back to patients within the first 3 to 4 minutes. And again, do understand Klara is a text message. So probably the expectation of the patient is not to get an immediate response, right? Nor are we expecting him to provide an immediate response, but now he's getting something where he's not having to wait on a response that may go through an entire day to get a resolution to an item with the changes that we incorporated. I'm really, really, really happy of the partnership we've had, because I think that we have some working sessions Monday and Thursday where we bring areas of opportunity that we have together, bring these to Schweiger and discuss what can we do to improve these, right? We've got an ongoing smart sheet with different action items that we follow up on to make sure we can improve different processes. And again, this is a way of making a change in a workflow that had a huge impact in the overall patient experience, right? So I think that there's little things like those that you can incorporate, right? The fact that, our patients are utilizing Klara allows them, if they want to schedule, cancel an appointment, right? Some of these do require additional action from our agents that do these on the back end. Some of them don't, right? That helps improve and streamlines the processes. And as different medical practices are growing, it's very important that they start looking at different options to utilize technology and incorporate them, because Laura mentioned, they've had some organic growth and also acquired different other practices. As you do this, you're going to continue to grow, and not everybody is set up technically the same. So you kind of have to work towards tailoring it towards your organization. And I think that technology is a big help for it, right? And sometimes we want to continue to do the things the similar way we did them before. And as we continue to scale and grow, we do need to start incorporating technology into the different aspects of communication to improve overall. And just to reference also, similarly in KM², right, we have worked with other medical practices, from setting up your contact center from scratch. We've had clients that, have worked everything from the office level, and they've grown so much, and they're like, hey, we need a contact center now. We need to set this up, and we don't know how to do it. We've done that before. We've had clients that don't have any documentation because it's been a lot of tribal knowledge that has been passed on in their internal center. So we've worked on documentation of training material, creation of it, setting up business rules and guidance, and also some initiatives that can help drive revenue generating ideas, right? Sometimes we propose some to some clients and they don't think they quite work, but when we've had the opportunity for them to give us a chance, we've seen a significant improvement on those that have taken that opportunity to take these, and this is something we've been doing as an organization now for the last 7 years in healthcare. So we do have that experience, and we've seen different, very, very good best practices to incorporate across.
Mm-hmm. Okay, great. That's great context. Janelle, maybe diving a little bit more specific into what types of customer interactions your team actually handles. Is it mostly inbound? Is it mostly outbound? And then second question will be towards workflows, but let's focus on the interactions themselves first. Sure.
So I would say that probably most of the work is on the inbound aspect with our medical practices. It's scheduling. We do confirmation reminders. We've also done some welcome calls with them, right? In some particular groups, we have a segmentation where we have a scheduling group, and then we have some sort of a customer service group that will answer questions regarding general questions, right? I wanted to follow up with the doctor. I'm not sure what my prescription said. Can you, questions such as these, right? We have a different department that could handle these. We do collections, right, on the outbound aspect, right? We do collections. We also ran outbound campaigns to help improve the overall appointments that are being scheduled. On the back office aspect, we have done also chat, text, and email. So definitely we do have multi-functions that we do take that have helped handle the overall interaction. As you make more options available to your patients, that will help better the flow of the communication, right? Because if you're only offering inbound solution for them and you don't have any chat or text, right, or email, some patients would rather communicate with you in those manners because they would probably not want to make that phone call. So it's real items that it's important for the different medical practices to take a look as to how they're communicating and not look at just one channel, right, as an inbound group, but also look at the other channels regarding chat, text, email, which can easily help alleviate the volume that you are getting on the inbound aspect.
Okay, great. And you kind of touched on it as well before, but maybe specifically talking to what are the workflows between the KM² team and Schweiger's office staff? Yeah,
definitely. I think we have a very unique workflow with Schweiger that has worked very well. We partner with the leaders in Long Island City that are part of the Patient Support Center. We have our weekly business touch base, but additionally to that, we've got 2 additional sessions in which they're pretty much strategy meetings to take a look at different items that we're doing and how can we improve processes. That's where we keep the smart sheet that we currently have going. Now, additionally to that, right, when you have your support center, right, and as I mentioned, right, on the people aspect, right, you've got the support center and then you've got your medical staff and your office staff. Something that we've done very uniquely is the fact that we have had our supervisors partner directly with office managers and the way that concerns, items, follow-ups with patients have been done directly with them. So this helps create a more cohesive environment between the office staff and us, where they see us as more as an extension than a group that is on the side, you know, simply scheduling appointments for them. So I think that's very unique to our relationship. And I think that has added value because again, you want the medical staff, you want the local offices to support your contact center.
Makes sense. And maybe, Laura, a question to you. Tell us about the results Schweiger Dermatology has seen since implementing with KM².
Sure. So, you know, I think we just have more, you know, overall, just much more capacity to, you know, support this central model. You know, one of the great things about partnering with KM² is that there's some flexibility. You can add, you know, we're able to add team members. Janelle talked about some of the other offline support that we partner with KM² on, whether it's on messaging or emails, scheduling, as well as post-care. So, you know, as far as the result, I'd say, you know, overall, we're just better able to handle the volume that we have. And, you know, Janelle also talked about, you know, really our collaboration. And of course, that extends to Klara in a very similar way that, you know, collectively, the way we're working on this whole kind of patient servicing ecosystem is on this iterative kind of continuous improvement model. So we've seen a lot of success to date, and we have, you know, a very significant agenda looking ahead of things that we want to do to increase efficiency, increase, you know, improve patient experience. So, you know, a lot of initiatives underway against that. You know, definitely I'd say at the most importantly, or, you know, really just like the fine point on your question, Simon, is just more scalability. You know, we've integrated a lot of offices over the last couple of years, and it's been seamless. And Janelle also talked about the role that some of the leaders play in connecting with the offices, and that's really helping us to achieve more of that local experience, because the people that are taking our calls, you know, are familiar with the providers, know the offices, know the general managers, and so forth. So.
Great. I mean, all these things are key to scale. Cool. Paige. Hey, yes. So Paige, coming over to you.
Yeah.
Maybe you can tell us a little bit about how your team works with Schweiger Dermatology and also other large practices to solve the communication issues and improve patient experience and do the things we've just talked about?
Yeah, of course. I think we touched on a few things already. Of course, we work very, very closely with Schweiger Dermatology, large organizations to, I think consistently understand their patient communication strategy, workflows, pain points. Our goal at the end of the day is to allow patients and staff to easily and efficiently communicate around their care without having to wait on hold or for a call back, which I know, especially for a larger organization like Schweiger, is a pain point. So kind of some general themes on how we look at doing that. I think, first piece is we look to automate and streamline workflows and take that human interaction out of the experience when it's not necessarily required. So, for example, voicemail integration for specific phone lines that don't necessarily need an interaction, we can transcribe pieces of that experience into Klara. And another kind of obvious example is appointment reminders. Currently, we automate over 250,000 messages per month for Schweiger. So freeing up some of their centralized patient support staff to handle conversations that require more attention. So those scheduling requests or those rescheduling requests that take that trained personnel to handle those interactions. And I think the centralization of the communication channels through Klara is both beneficial for the patient, but also the staff as far as experience. And I think Laura touched on this too. We're constantly iterating on how Schweiger uses Klara. So looking at their workflows, how their business needs change, and constantly developing how we're leveraging Klara in their organization.
Mm-hmm. Great. And you touched on a couple, but maybe you can point out some of the key patient interactions where Klara streamlines things for Schweiger Dermatology.
Sure thing. Yep. So I think I already mentioned appointment reminders. So, reminding patients of upcoming appointments, pre-visit instructions. Another key piece or interaction that we're able to automate is no-show engagement. So we're able to follow up with patients that don't show up for their appointments. And then some other pieces that, I think we use Klara heavily for is scheduling requests, rescheduling requests, telemedicine instructions. And another big piece is insurance follow-up and collection. So being able to, collect that information from a patient prior to their visit. All of these interactions are streamlined through Klara and supported with predefined messaging templates. And I think these templates do a good job in saving the staff, time, thousands of hours per month.
Great. And aside of these patient interactions, does Klara improve internal staff communication and collaboration as well?
Yeah. So I think, of course, Schweiger has a centralized patient support center in many different office locations. So, one big benefit of Klara is allowing for that centralized support staff to actually communicate with the respective office locations around patients. So looking at kind of the internal discussions in Klara, there's a large amount, around 40,000 internal notes per month that allow staff to collaborate if they aren't necessarily in the same location. And I think another big piece, and I think we've mentioned this a bunch of times, but being able to reference previous conversation history in Klara is definitely something that helps to improve internal staff communication and keep everybody on the same page. Because within Klara, all patient communication does live beneath one record for each patient.
And Laura, maybe can you tell us anything about the results Schweiger Dermatology has seen since implementing Klara?
Absolutely. I think Paige touched on a lot of really good examples. We had a reminders effort, prior to Klara, and made the switch to the Klara reminders because they were better integrated into our system. and we're going to have more capability as well. And so we've seen, good impact as far as, no-show and cancellation, as a result of that. So some upticks there. I think it's the velocity, the speed, and the scale of communications. Paige talked about some of the details there, but we're really facilitating very quickly a lot of customer interaction. And Janelle talked about the asynchronous nature, which is really good because it allows us, if we get a whole flood of messaging, everyone who runs a practice knows that the beginning of the week is typically much busier than the end of the week. The conversations they're text-based, but if sometimes we can respond in real time, under a minute, kind of thing. And sometimes it might take us an hour or two because it's a really busy time of the day to get back. And so we're able to, really manage those conversations a little bit better, with our availability. So whereas when people are calling, they hang up if they don't get you. And so this allows us to really manage workflow just sort of more efficiently and effectively, because we can answer, as we strive to do it as quickly as possible and really in real time. But it allows us to have, to manage a super busy Monday or Tuesday more easily. Certainly our volume has grown so much. So it's hard, Simon, to say, all of that is because of Klara or all of that is because of KM². There's so many variables in the growth of our practice, but we are just seeing continuous growth, and it's totally supported through these platforms. One other thing that Paige didn't mention, I'll just throw in, is just the scheduling capability also now that's coming from Klara that we're very excited about and starting to pilot with as well. So we're looking forward to seeing some good efficiency through using the automation associated with the scheduling capability. So that also will be a good result for us as well. Great.
That's awesome to hear. Since we're good in time, I can ask a couple more questions and then we can move into Q&A. Maybe sticking with you, Laura, after implementing this new communication strategy and the new patient experience strategy, what worked and what didn't work?
Sure. I'd say what works very well is that we just have this, very significant scale that we're able to manage. An ongoing challenge for us is, is that flow piece where, we don't always, every day isn't the same. And so, how do you kind of triage messaging and manage backflow? So that's something that we continue to work on. Like I said, the scheduling thing, I think, is going to help us gain efficiency. And then, one of the things we did with KM² was, a model to create kind of local hubs that's been effective for us. So that allows us to have not every agent isn't associated with every office. So we have some localization within the process. That's also been successful, but, continuous improvement needed to really deliver on the most hyper-local possible experience. Mm-hmm. I'd say those are some of the ongoing pieces. We talked a little bit touched on patient engagement, building awareness of the platform, and then of course, provider engagement, whether that's a new practice we're onboarding or providers that haven't been as engaged with some of the digital platforms, maybe historically hasn't been a part of their practice. So, just kind of continuous communication and training on how to utilize all of the tools, given that it is, really like a kind of a hybrid approach of a central local, kind of hub and spokes model. So, all of those things are really both successes, but continuous improvement areas as well.
Mm-hmm. Great. Anything you still struggle with today with regards to patient communication as a whole?
Just always want to make it better. We're trying to, our mission is to create the ultimate patient experience. And so, certainly what happens in the exam room is really the most important. And thankfully, that's not something we have to build. We have that. And everything around it, patient expectation, customer expectation is that you know them, you always know who they are, you always know everything about them and can meet them where they are. So, that is our goal, and that's what we're going to keep working on every single day. So just a lot to do there.
And touching on what you just said, what's your vision for improving the patient experience in the future? And maybe also, what do you consider to be a perfect patient interaction?
Really, we just want it to be totally frictionless. We want to be available when the patient wants us. We want to get their answer to them quickly and efficiently. And if there's a lot happening behind the scenes to make it happen, they shouldn't know what's happening behind the scenes, so that for the patient, it's truly frictionless. That's what we're going to continue to work towards. So, something that we're going to do soon is, build chat through Klara onto our website. And we're excited to do that. We want to really deliver on very quick response there. Given that patient expectation may be that it's synchronous versus asynchronous when they initiate, a chat. So, just more to do. And because we're always growing and bringing on new practices, there's always new people to, onboard to Klara. So I'd say the perfect interaction is totally frictionless, and that the customer rates it a 10. And, we're just trying to build more tools to make that more efficient, so that our cost per patient goes down over time, not up, as we make it better for them.
Great. Thanks. And maybe the last question, and then we go to the Q&A. What's your advice for someone looking to work with an outside vendor on these things?
I think really be clear of the problem you're trying to solve, and, talk to a few people. I mean, you have to really interview the technology and the team you'd be working with to understand that they're going to be the right team for your practice. Absolutely need to have accountable people within your organization who are working on these programs. So I'm sure for smaller practices that don't have, a patient support team, a huge team, or a marketing team, that may be more challenging, but don't expect that you're going to just, buy it, put it in, and it's going to just work on its own. We work with Janelle and the team every week. We have meetings. You can see Show Mula on the call as well, on the panel. She's one of the team members that I work very closely with. She, is in constant touch with Paige and the Klara team. We work with the product development team on Klara, so that we know what's coming, and that we help inform even how things are built to some extent, or at least help share our requirements. So, I think understanding that, you're looking for a long-term relationship. And so my advice is, know what you're getting into, and make an eyes wide open decision.
Great, Laura. Thank you so much, and everyone on the panel. We can now turn into the Q&A session. We have 15 minutes left, and there are some interesting questions popping in. Laura, you already answered two, but maybe for the whole group and the whole audience, we can pick them up again and quickly talk about it and walk through the questions. So the first question coming in was by Sean Miller. Thank you very much. Saying we have the same general business model with 60 clinics in 5 states and have a centralized scheduling department. How have you used both front office employees and centralized teams in coordination with Klara? And Laura, you can go first. Maybe Janelle can chime in.
Yeah, I mean, as I said, Sean, it's, and I'm happy to chat with you, separate from this webinar. For us, it's really everybody is working on Klara and patient communications. So, we have our teams that are receiving the messages and making sure they go to the right places. And of course, the local teams have to, and providers, whether it's the the doctors, the physician's assistants, nurse practitioners, they're interacting, or the medical assistants or patient coordinators, maybe at the office level, coordinating with patients as well. So it's truly a hybrid model where the right person to answer the question is getting the question. So if we can answer it centrally, it's a reschedule situation, that typically happens centrally, but, a post-care question is going to get answered by the provider or the team at the office.
I'd just like to add, right, Schweiger has been amazing in partnership with us because, again, sometimes you may have organizations that don't want to provide their nearshore outsourcer access to the system, right? So we have full access to all of these. So it's very easy to interact, to work through assignments, and not just with Klara, but with all the different other platforms that Schweiger utilizes, right? Providing that full access to whomever you've decided to outsource your business with does provide some key aspects, right, to improve and streamline communications. Again, it takes away that aspect of trying to do things manually, and it streamlines it all through the same process. And then, as Laura mentioned, the organization, right? And we become part of Schweiger as well, and we move forward in the same vision. So thank you so much for that, because definitely I think that's a key for our success.
Yeah, a good point. Next question from Raymond. Have you found that automations have improved customer experience? For example, patients prefer this option over, say, a phone call, and therefore increased efficiency and thus reducing overall costs?
Yeah, I mean, it's a great question, and it's a tough one to answer as far as, the specific cost benefit, because we have a lot of different pieces that are all joining together. But I think the short answer is the automation absolutely helps to save time. As Paige said, a lot of, reminders, for example, that's going to save time at the office level to confirm an appointment. A lot of people are just automated confirming their appointments now, or rescheduling. Instead of calling us to reschedule, they're responding to a patient reminder. And so, we do see a lot of people choose to participate in Klara. And for those people, that's their channel of choice. And it's definitely more efficient for us to interact via a Klara than it is via a phone call. Even the voice transcription that Paige mentioned is a save. If we don't have to listen to the voicemail, and Klara can turn that into a text message for somebody, that is a big time save. And the transcription is very strong. We really find that is, quite good technology. We don't generally have to re-listen to the message. Some people are never going to, do a text, just like some people don't want to call, and some people are going to email. And, so it's really that kind of channel of choice kind of concept. So definitely is enabling this growth and surely saving cost. And that's really our goal is to drive down, cost per visit, cost per patient interaction.
Mm-hmm. Good point. Next question, maybe Paige can take that. Since Schweiger Derm is on ModMed PM and EMA, also from ModMed, is there an integration into the EMA side with any of the clinical patient messaging back and forth? Or do you have to reiterate the highlights of a patient conversation into a chart note or task?
Yeah, that's a good question. With the integration between Klara and ModMed, you are able to automatically export, not only forms, insurance cards, any type of document that's exchanged with a patient, but also pieces of the conversation that need to be a part of the medical record. So if there's something important within Klara, it's very easy export back into the medical record, no manual work.
Great. Then a related question from Darla. Does this import over to ModMed, or would we need to access Klara to view these communications?
Yeah, I think I can take part of this. I think going off of the last question, we can export all of Klara into ModMed. So what we say is if it's important to be a part of the medical record, that definitely needs to be exported into ModMed. There are some things that can live in Klara. Klara will save everything about the conversation and the history. So you can always reference back to that conversation as well with the patient.
Okay, great. Another question from Sandy. Laura, do you do anything extra to get more patients to complete the pre-consult or pre-appointment paperwork?
So, I may ask you if you want to add any point here. We certainly have efforts underway, within our visit prep, we sort of one day out to make sure that we are, getting everything we need prior to the visit, whether it's insurance eligibility, capture, and things of that nature. So absolutely more work to, try to get the pre-appointment paperwork complete. I don't know, Sho, if you want to add anything to what I said there.
Sure, absolutely. One of the big things that we request from our patients at the time of scheduling is to actually send us their insurance card pictures front and back via Klara. To Paige's point about like exporting, those can be directly exported into ModMed, which is great. This way we have kind of the most crucial piece of information required for scheduling. You can create Klara forms that export into ModMed if there's additional paperwork that you want them to complete prior to the appointment. But at this time, a lot of our stuff is actually check-in via ModMed's patient portal and through the kiosk that we check in the waiting room.
Someone had asked about the difference. I lost the question here. I don't see it in the thread anymore, but a question about the difference between a patient portal and Klara. I don't know if Paige, you want to answer that, or Simon, you want to address. I don't know if anyone can still see that question. I'm not seeing it anymore.
It's up here. What could be the difference between a web portal account and Klara?
Yeah, Simon, I can tag team it with you. I think, one of the main differences, I would say right off the bat, and the biggest one is adoption. With patient portals, you definitely see, a lower adoption rate from your patients. With Klara, on average, you see 85% of your patients adopt. And I think part of the reason for that is accessibility. We don't require patients to remember a password, download anything. All they'll need to do is, verify their phone number and date of birth in order to communicate with you. So it makes for, a seamless experience.
Yep, absolutely. I totally second this. And basically to also add to this, it's because Klara is a conversational experience, so it's all revolving around a conversation, which is a natural way to interact between people. And we build things on top of this. So forms are part of the conversation and the message. Document uploads are part of this. Scheduling is part of it. And we soon will have payments where you can collect credit cards and also request payments from patients. And that all happens in a conversation, which is very intuitive and easy to use. And that's how we built our product from the get-go. And patient adoption is definitely one of the main differentiators. It just works. Maybe a couple more questions. So there's one by Maureen. Laura, have you all used Relation? We went live with ModMed this year, and Relation seems similar to Klara. Can you explain why Klara would be better?
Yeah, so Sho, I may ask you to chime in here, but we were using the Relation reminders before we switched to Klara. And while the Klara reminders did not have email capability and the Relation did, we felt that, having that the technology of Klara was ultimately better, and that given we were using Klara for so many other things, it made more sense for us to use Klara. We did test, before we made that full shift across the practice. We did pilot first the Klara reminders to ensure that we saw, improved or same response on no-show cancellation, which we did. So, we were able to, and it was a cost reduction for us because there was really no incremental cost to we were already using the Klara platform. So it was a cost benefit for us to do that. Sho, do you want to speak at all to the the rationale there? Anything else you would add?
Sure. Yeah, I think the benefit of Klara versus Relation is it's all in one place. So the patient is using Klara to get a reminder about their appointment. They're using it to ask follow-up questions after their appointment. They're using it to schedule their next appointment. So it really goes full circle in keeping the patient engaged through this one platform rather than getting it through, a couple of different channels of communication. And in the event that a patient deviates from, whatever standard request call to action is on the reminders, all of those messages come into Klara and can be manually handled by a team rather than just getting an error message.
Great. Thank you so much. Maybe a last question. We have 3 minutes left. Laura, do you have designated staff that only works with Klara or KM² from Darla?
We have dedicated people. So, the KM² team, of course, is dedicated to the business. We have people that are dedicated to Klara. Absolutely. We have such a significant volume of messaging. But for a lot of people, it's just part of their job. So the office care teams, they're responsible locally for the Klaras that go to them. And so for those team members and providers themselves, of course, they're not fully dedicated. They're using it as a communication tool. But we definitely have people whose job it is all day to answer Klaras. Yes.
Okay, great. A quick question. I see we can still move in from Bina. Do you guys also import from Athena? So do you have an integration with Athena Health page? You can answer this.
Yes, we have an integration with Athena Health and all similar functionality to what we've touched on today.
Okay, great. So I think we're at time now. We are right at the end of the hour. So I just wanted to say another big thank you to all of the members here of the panel for such a rich discussion. Thought there were really good points. I'd also like to thank everyone here in the audience who attended and made this webinar such a big success. If you're interested in contacting Klara, if you have any more questions, I know there were actually some questions we weren't able to answer, please reach out to us at Klara through hello@klara.com. If you want to contact KM² for their services and solutions, contact marketing at KM²Solutions.com. And if you have questions to Laura, just contact her on laura.fink@schweigerderm.com. Thank you very much for your time. Thank you very much for your attention. I think this was a really worthwhile hour to spend. Thanks for attending, and we hope to speak to all of you again soon. Thank you very much and have a good day.